Debates among Nebraska lawmakers will revolve around attaching a 12-week abortion ban to the proposed trans youth healthcare ban. On Tuesday night, Nebraska legislators will discuss a proposal that involves adding a 12-week abortion ban to a bill that already prohibits gender-affirming care for transgender minors. When the two contentious measures are combined, it creates the potential for a highly volatile debate during the session, making it one of the most explosive topics. Lawmakers are scheduled to engage in the last round of deliberations on the trans health bill. This bill has progressed through the first 2 of 3 rounds needed to pass and reach Governor Jim Pillen's desk. However, due to legislative regulations, any amendments cannot be appended to bills in the final round. Therefore, lawmakers need to discuss if it is necessary to send the bill back for another round of debate to incorporate the abortion amendment. Those who oppose this decision intend to prolong the discussion for the entire 2-hour duration of the bill's final reading by utilizing a filibuster. In the singular non-partisan legislature, Conservative members must secure the support of 33 out of 49 senators to terminate the discussion and proceed with merging the two issues. Failure to do so will result in the shelving of both bills involving abortion and transgender health for the remainder of the year. The recent failure of the Conservative bill to ban abortions after detecting cardiac activity, which typically occurs at around 6 weeks of pregnancy, before most women are aware of their condition, left them reeling after it failed to pass by a single vote due to a filibuster. Typically, a matter that has been discussed during a session would be set aside for future meetings. However, in a recent session, legislators who were opposed to abortion attempted to revive the issue by creating a proposal that would forbid abortions after 12 weeks. This proposal was then linked to a bill concerning transgender rights. According to Conservatives, the 12-week amendment is a potential compromise that could garner the necessary 33 votes for its approval. Conversely, the opposing lawmakers argue that this amendment is an unusual effort to revisit a policy that the legislature's Speaker had previously promised would not re-emerge this year. The trans health bill has been the most disputed bill of the session, further contributing to the chaos. The legislation was initiated by newly elected Senator Kathleen Kauth and seeks to prohibit minors under the age of 18 from receiving hormone treatments, gender reassignment surgery, or puberty blockers. A revised edition of the bill would allow for certain exclusions for minors who had already begun hormone treatments prior to the imposition of the ban. However, it would also grant broad powers to the state's principal medical officer to establish regulations for hormone treatments prescribed to transgender minors. Critics argue that this would enable a politically appointed official of a Republican governor to deny hormone treatments, even to those minors who were exempted. Throughout this year's state legislative sessions, Conservatives have been targeting both abortion restrictions and transgender individuals with a persistent focus. After the trans health ban was introduced, Senator Michaela Cavanaugh of Omaha made a promise in late February. She swore to stop the legislative session altogether if the ban was pushed forward. Despite her warnings, the Conservative Health and Human Services Committee advanced the ban anyway. In response, Cavanaugh launched into an extraordinary filibuster, blocking every bill in front of the committee, even those which she endorsed, until the trans health ban was either abandoned or defeated. For almost 12 weeks, she, along with a group of legislators, has successfully managed to obstruct the bill, despite it surviving by a mere vote during the initial and subsequent rounds of discussion. The filibuster has considerably impeded the progress of the legislature this year, leading to lawmakers bundling bills together and enduring arduous 12 to 15-hour workdays to pass legislation. Lawmakers will have the opportunity to vote on merging the abortion and trans health measures. Should the vote pass, the lawmakers will immediately resume the debate on Tuesday night to determine whether to send the combined bill to a final round of debate. If the bill is sent to the final round, it is expected to take place on Thursday, and it is predicted to pass. If it passes, the amended bill will be signed into law by Pillen, a Republican who was elected in November. As soon as the governor signs it, the bill will go into effect since it has an emergency clause. To support our channel's growth and ensure broader awareness, kindly hit the like and subscribe buttons. This will help us reach more individuals and disseminate valuable information. Thank you in advance.